Assalamu alaikum. My name is Dr. Kamran Pervaiz. I am working as an assistant professor in the Department of Prosthodontics in Liaquat College of Medicine and Dentistry. Today we are going to demonstrate regarding the impression techniques and materials which are used in different parts of prosthodontics. So we are moving towards our patient. We are taking your impression. Can we take your impressions? The first protocol for taking an impression, you have to take a written consent or verbal consent to the patient that we are using different materials on her. Okay? The protocol, light on कीजिएगा. The protocol for collecting recording an impression first is the trace. We will see the intraoral examination first, and we will see what is the extension of the patient's mouth, where the third molar placed, where the buccal sulcus is deep or shallow. So we decided to take an impression in a medium sized tray. Okay, we place a tray in the patient's mouth and we'll see whether it covers the buccal sulcus or the labial sulcus. You can see the patient is comfortable with the right side and the left side as well. You have to put your hand onto the buccal cheek, and you have to place your left hand on the left cheek mucosa. Are you comfortable with it? Guys, आपको चुप तो नहीं रहा? Comfortable हैं आप? Is there any gag? Comfortable? Now the tray has been selected, and now we are moving towards the technique for taking a primary impression for LZ impression materials. So we are using a ball and spatula. Straight spatula is used for the for the mixing of alginate impression materials, and we are taking around 2.5 scoop for an upper maxillary impression. The saturation of alginate impression materials are the sequential and the spontaneous one. The powder ratio and the liquid ratio should be equalized, so the hydrocolloid can mix simultaneously with the water-powder ratios. We will spatulate or saturate the liquid with the powder one. First we hydrate the material with the water ratio. The spatulation should be in a zigzag pattern. A simultaneous spatulation should be done. Your palm should be forced towards the rubber band ball. There is a gel formation of alginate during the mixing. It is around 45 seconds to 1 minute for a mixing time that is required for the alginate impression materials. Then you have to put the impression materials on the tray equally on each side. There is no excess. We have to remove the excess from the right and left side. Now you can see a gel formation on the impression materials. Now we have to put this impression material on the patient's mouth. The putting technique would be, we have to retract the left mucosa and put it right there. Open up, badam kholiye. You have to see the middle midline, and you have to press the impression tray equally simultaneously from all sides, from the mid palatal area, from the right palatal area or the left palatal area. The pressure should be excessive and simultaneously on all sides. If you can see, the tray handle is exactly on the middle side of the nose, mid-palatine ratio. Ideally, the setting time, or you can say setting time for the alginate is around 30 seconds to 45 seconds. It depends upon which type of alginate material we are using. There are 3 types of alginate material that we use: the fast setting, a slow setting, which depends upon the catalyst that is required for the impression materials in the alginate. You can see the gel form is converting into the rubber form, and now we can see the material is setting towards this final stage. The technique to retract the patient trace from the patient's mouth is you have to de-seal from the palatal area first and from the labial area as well. The tray handle should be on the right side. My thumb should be on the handle. I have to retract first from palatal area and from the labial area, and then we have to put zigzag motion and towards the right and left one. You can spin it. You can see a perfectly recorded impression has been recorded, equal size on the right and left side. Okay. Now after that, completing a technique, any clinical procedure, you have to thank the patient. You have to compliment the patient that you have done this procedure recording the consent of the patient. If you can see the whole scenario, whole technique that we have used in this scenarios, we have to put different types of stoning materials or a pouring material for making a steady cast or model cast. There's different techniques that we can pour these types of impression materials. We will record it this time in the next session, inshallah ta'ala. But actually the most common material that is used for the pouring are dental stones, And there are two types of concept that we can pour the alginate impression materials immediately, because these are the material that can soak air and a water bubble as well. वेट गॉस या वेट मटेरियल को ऐड करते हैं ऑन द एरिया जहाँ पर हमें रिकॉर्ड करना होता है तीत के एरियाज़ को. इसकी वजूहत ये होती हैं कि अगर आप ऐसा करते हैं तो आप इंप्रेशन मटेरियल को बचाते हैं डिस्टॉर्शन से. इसका सबसे बड़ा ड्रॉबैक एल्जिनेट का ये है कि ये बड़ी जल्दी डिस्टॉर्ट हो जाता है इन एयर कंटामिनेशन और वाटर कंटामिनेशन. आफ्टर टेकिंग एन इंप्रेशन फ्रॉम द पेशेंट माउथ, this should be go straight forward to the disinfectant materials. The disinfectant materials with the impression materials are glutaraldehyde, 8%, 9% glutaraldehyde, which should be soaked for 5 to 10 seconds in a different types of solutions. So last we have demonstrated the basic protocols for taking in primary impression materials. Inshallah, we'll see you soon in the next session. Jazakallah khair.